Mm-hmm.
And we're ready and rolling when you're ready.
Good afternoon, Fairfielders. I am First Selectwoman Brenda Kupchik, and I just want to start off by saying thank you to all of you for following the physical distancing guidelines and helping to keep your friends, your families, our neighbors safe. I know this situation has not been easy for anyone, not for our nurses, our doctors, our first responders, teachers, parents, employers, employees, or organizations. It is a challenging time for so many reasons. Many residents have lost their jobs or their businesses. Some have lost loved ones. This pandemic took us all by surprise, but we are doing all that we can to protect you and your families. My top priority for our town remains the health and safety of our residents. And throughout this pandemic, I have relied heavily on the guidance of our health department and medical professionals as part of our emergency management team to make the best decisions we know how to protect our community. I know everyone is eager to get back to work, to get back to our normal lives, but we are just not there yet. Our health director will speak shortly to bring everyone up to speed on where we are in the varying models, but I do have some hopeful news to share. I want you to know that our early efforts as a community to protect each other and stay apart is making a difference. According to the Connecticut Department of Health, Fairfield's case rate is 538 per 100,000. Only Easton, Monroe, and Newtown have lower case rates. Fairfield currently has the lowest case rate in all of Fairfield County coastal towns in the I-95 Metro North corridor. I am working on a plan with our emergency management team to lift some restrictions placed on our outdoor and open spaces. The details will be announced early next week. The approach we are taking is data-driven and will not be governed by emotion. What I do want residents to know is that we will be limiting access to certain town spaces to Fairfield residents only. I encourage all of you to get your beach stickers if you haven't already yet. You can purchase them online and they will be mailed to you. We have to plan carefully and consider all factors while we phase in the reopening in order to prevent a spike in new infections. As you know, the governor issued an executive order that any person in public who can't maintain a 6-foot difference should wear a mask or face covering. This is for a shared benefit for our community to keep the transmission rate low. Sadly, the Memorial Day Parade Committee and the emergency management team has decided to cancel the Memorial Day Parade. We will make a point to incorporate our usual Memorial Day ceremonies later in the year. While this decision wasn't made lightly, we simply felt it would put too many of our residents at risk, especially our veterans. The Southwestern Connecticut Agency on Aging is in partnership with the Fairfield Social Services and participating Fairfield senior and disabled housing sites, is providing groceries to seniors 60 or older who are deemed by the CDC to be at greater risk of a serious complication from COVID-19 virus if they leave their homes to grocery shop. The program is available for seniors who do not have any means of accessing groceries or do not have a family to shop for them. Each pre-packaged grocery bag provides a 1-week supply of shelf-stable items as well as fresh produce, eggs, butter, milk, and toilet paper. No contact drive-through pickup will be available at the Bigelow Senior Center for those who do not reside in participating senior and disabled housing sites. To sign up for the program, please call 203-256-3169. I will also be putting this in my newsletter today. I am very proud to announce that our Fairfield COVID-19 Relief Fund has already raised $50,000, and we have received 21 applications, with more inquiries and paperwork pending from residents who are seeking financial aid. I want to thank everyone who has generously contributed to this fund to help those residents who are struggling financially because of the pandemic. I continue to be inspired by the way our community has come together. We may have 61,000 residents in Fairfield, but to me, we are like a small town, the one that I grew up in. And I am thankful. While this has been an enormous challenge, I feel so incredibly grateful to serve as your first Selectwoman. I will now turn this over to Sands Cleary, our Health Director.
At this current time, there have been 335 positive COVID cases reported in Fairfield and 38 deaths. 117 of the positive cases reported that they have fully recovered at this time. As you know, there are likely many more cases out in the community amongst those who are either unable to get tested or did not experience any significant symptoms and have recovered without medical intervention. 73% of our positive cases have occurred in the general population of Fairfield, while 27% of those cases have been amongst nursing home residents. Of the deaths that have occurred in town, 24% have occurred in the general population, while 76% were nursing home residents at the time of their passing. As you know, these are our most vulnerable residents who are at the highest risk for severe outcomes from this illness. We must continue our work to protect them and all the residents and workers of Fairfield. All Fairfield's nursing homes are currently impacted by COVID-19 and have had positive cases and deaths at their facilities. The State Department of Public Health, who licenses these facilities, has been in contact with all of them, has conducted inspections of them, and is providing guidance on how to manage positive patients in their facilities. In addition, the town is in contact with each facility multiple times per week, and we have been working with them to address any PPE needs as best we can. Some of the predictive models that are available have Connecticut and Fairfield County just past the peak of hospitalizations and deaths, while other models have that peak occurring sometime as early as the first week of May and as late as the last week of May. One of the primary variables that influence when that peak occurs is how strict people adhere to the social distancing, the isolation of the ill, and the quarantine protocols for those who are exposed to the ill. These activities, at some level, will need to continue until a vaccine is developed. Other data sources related to Connecticut hospitalizations provide us with some cautious optimism that while some Connecticut hospitals have had very significant demands placed on them, they have not been overwhelmed and have had adequate numbers of ventilators to care for the most ill patients. It is important to remember that whether we are at the peak, just after the peak, or still a few weeks from the peak, that we have several more weeks where significant social distancing measures are likely to stay in place. In addition, it is important that everyone understands that this is the first peak of what will likely be 2 to 3 peaks of COVID-19 activity that could happen over the next year. As we get more data to confirm that this peak is behind us and that hospitals have the capacity to care for patients, we will begin the process of cautiously lifting a few of the measures that have been put in place, starting with those that are least likely to cause an increase in transmission and cases. Some of these layers lifted initially will likely include allowing outdoor activities such as walking or hiking in town parks or on beaches, and the opening of golf courses. It is very likely that no mass gatherings will be allowed for quite some time, and that our more vulnerable residents will be advised to stay at home as much as possible. Until medical therapies are readily available and a vaccine is developed, all our lives will be different to some degree. We want to thank all of you who have worked to protect our fellow citizens through adhering to social distancing, and we also want to thank the medical professionals, first responders, and town employees who have worked to keep us healthy and safe and to keep the town services functional. Thank you.
Good afternoon. My name is Dennis McCarthy. I serve as the Emergency Management Director for the town of Fairfield. Let me begin by thanking the residents and business of the town of Fairfield for your cooperation as our community responds to COVID-19. It is encouraging to see our friends and neighbors observing physical distancing as we go about getting necessities at the grocery stores and pharmacies, obtaining dinners at local restaurants, or just while enjoying some fresh air and exercise. Your efforts have certainly contributed to the low infection rates in our community, which are among the lowest in the region. Your efforts are not without sacrifice. Local restrictions have created frustration and increased anxiety, and I want to acknowledge those feelings and thank you. Many have called and written suggesting that they can go out safely and restrictions are too onerous. In a community of our size, that just isn't the case. Even in our wide open spaces, groups have been formed, risking infection and spread of the disease. For the long-term health of the community, short-term restrictions have been imposed, and they have been successful. We were cautious and measured when we instituted these restrictions. We were determined to be responsible advocates for public health using the best options for the non-pharmaceutical protections available to us. They included physical distancing, limited contact outside our immediate households, and face coverings. Our team has a matching responsibility for the public health as we consider loosening those restrictions. We do not take this responsibility lightly. Now, almost 2 months later, in the absence of a vaccine, our resources continue to be those limited to those same non-pharmaceutical protections: face coverings, physical distance, and limited contacts. As we look forward to recovery, we will apply the same cautious and measured approach to the relaxation of these restrictions in order to prevent a spike in infections. We respect that many may feel that we have gone too far and are moving too slowly towards recovery. I ask you to trust that we approach these decisions with the professionalism of the local subject matter experts and department heads. They have built and sustained this town over years and have created the safe, welcoming community that we all enjoy. This group has only the best interests of our community at heart. These professionals always strive to balance the needs and perspectives in our responsibility for protecting the public health and safety. If we err, it'll be on the side of your safety. As the town revises our preventative measures, it is crucial to understand that we are not reducing our recommendations for physical distance or face coverings. So as your options for out-of-the-home passive recreation increase, remember that in order to prevent a spike in cases, which could require further restrictions, continue to limit contact outside your immediate household. Practice physical distancing of at least 6 feet and use face coverings while in public. We are not out of the woods, and this crisis is not over. Fairfield residents will continue to become infected, and sadly, the fatalities continue to mount. Despite all, there is reason for optimism. We are working towards recovery carefully, prudently, and responsibly, and we ask you to be careful, prudent, and responsible as well. And let me introduce Chief Chris Liddy from the Fairfield Police Department.
Thank you, Chief McCarthy. I'd like to start off by saying we are hopeful that we are going to be slowly reopening some things to give us all a small sense of return to normalcy. The vast majority of people have done a great job of staying home unless absolutely necessary and adhering to the guidelines that we have put in place thus far. To those people, we say thank you, and we truly appreciate your efforts in helping us to slow the spread of this virus. Even though we may be reopening some public spaces, it does not mean that we are out of the woods yet, and physical distancing must be aggressively practiced at all times. As things do begin to reopen in the coming weeks, we want to remind everyone to be more vigilant about pedestrian and driving safety. A lot more people have been out on our sidewalks and streets, and we've received a number of complaints about drivers speeding and ignoring traffic laws. Just because our roads have less cars does not mean that the laws of the road do not apply. We will be increasing our traffic patrols throughout the town of Fairfield in order to make sure that our roads are safe for drivers and pedestrians alike. The Fairfield Police Department remains fully staffed and committed to serving our residents and community members. We have received a lot of well wishes and gratitude from the residents over the past few weeks. Those heartfelt words and gestures have meant the world to us, and we are thankful to everyone who has reached out to us. Thank you, and stay safe.
I would just like to take a moment to recognize the members of our emergency management team, your emergency management team that represents everyone in our community that's been working around the clock to make sure that we're protecting all of you, every single person in our community. So I just hope that you'll remember that there are people who are working really hard to protect us, to protect all of us in our town. And I just want to remind everyone that we aren't putting these protocols in place in a vacuum. This is going on throughout our entire country. These are CDC guidelines that have been cast across the entire country that we are all following. This is a national health emergency, not just an emergency in the town of Fairfield. And I know everyone is feeling extraordinarily frustrated and has high anxiety. We feel it too. But we are working really hard to make sure that we protect the people in our community. And as we work to reopen our spaces in a very cautious and methodical way, please have patience and understand that we're doing everything we can to make sure that everyone in our community can have some release and get some little mental health, but we all have to also still follow those guidelines. So please watch for our newsletter next week. We're sending one out today with some information, with actually quite a bit of information. But next week, we'll be able to tell you more information about how we will be reopening our public spaces in a way that will protect everyone, but also allow each and every one of us to enjoy a little bit of the outdoors outside of our own backyards and neighborhoods. So thank you so much, and take care.